Welcome to Beautiful, Confident, and Safe, a podcast by Lewisburg Plastic Surgery featuring Dr. Normington. Hi, I'm Jordan Thomas. In each episode of this show, Dr. Normington and I will sit down for an unscripted conversation about a variety of plastic surgery topics. Our goal, as with everything we do here at Lewisburg Plastic Surgery, is to provide you with the educational resources you need to make the best decision and allow you to feel beautiful, confident, and safe. Let's get started. Hello, Dr. Normington. How are you today?
I'm great, Jordan. Thank you.
Good. So I know most of our episodes we've touched on the plastic surgery side of our practice, but we also see patients for dermatology issues. Can you kind of explain a little bit more about that side of the practice and how you take care of patients in that way?
Yeah, sure. The two specialties really go hand in hand. Dermatology deals with the skin, obviously, and plastic surgery is surgery on the skin. So they really go hand in hand. So we've tried to grow our medical side of the practice. We have Erin Abanasar, who is a physician's assistant who is trained in dermatology, and she has, I think, about 10 years of experience in dermatology. Erin handles all of the medical issues in our dermatology practice. She'll see patients for rashes and skin issues, acne, things along those lines, but also does skin screening. So if a patient has a concern about a mole or maybe a family history of skin cancer, she'll see patients and do a thorough skin exam. And then we'll also perform biopsies on lesions or moles that she has some concern about. Skin cancers are unfortunately very common. Here in central Pennsylvania, it's a very agricultural area. Skin cancer is caused by the sun, so a lot of folks have a lot of sun damage or have spent too much time by the pool or in that tanning booth. So we see a lot of skin cancers. So if Erin finds somebody with skin cancer, she'll pass it off to myself, and we'll remove the cancer and then do reconstructive surgery to repair the area.
Right. So is that how you got your start then in removing skin cancers?
Yes. Okay. Yeah. And it's actually a very busy part of the practice. Mm-hmm. We literally spend at least a day a week just removing skin cancer. So it's a very popular, unfortunately, a very popular procedure. Yeah.
Right. So what sort of anesthesia do you do that under? Is that just like a local?
Well, luckily, many of these things are something that we can treat in our office operating room, and they're procedures that we can remove with local anesthesia. So generally, you don't need to go to the hospital. And with local anesthesia, we can numb things up the same way a dentist might numb up a tooth. We're able to numb up that mole or skin cancer and then remove it and then fix things up. The process can be pretty simple and pretty easy.
And would you say a patient can possibly benefit from having their skin cancer removed by you, like a plastic surgeon versus just like a dermatologic surgeon?
Well, there's some benefits. We can handle the reconstructive aspect of it, right, whereas sometimes family doctors or dermatologists might not have that experience. So we're able to handle those sometimes tricky reconstructive patients that need a little bit more. And
then healing, that like for patients, they can kind of feel a little bit more at ease having you do it as opposed to just any other surgeon.
That's a good point. Yeah, right. We can help them with the healing process. Yeah.
Right. And then sometimes I'll see Erin will have to refer some patients over to like Geisinger dermatology to undergo a Mohs procedure. Can you explain to me what that is and why we don't offer that at our office?
Sure. So Mohs is a specialty in and of itself. It's a technique where the skin cancer is removed. It's really indicated for skin cancers on problem areas like the eyelid or the nose, where cancer is removed basically in layers, and each layer is looked at under the microscope. It's fairly time consuming, but it is indicated, for certain types of cancers. If our practice thinks you need Mohs, we have a good relationship with the Geisinger Mohs surgeons, and we'll refer patients over there. Every patient does not need Mohs surgery. In fact, I don't think most do.
Right.
But we will refer somebody if it's necessary.
Yeah. And I've seen like after pictures of patients that have had Mohs procedures before, and it tends to be a little bit more of a scar, definitely more noticeable than just having it excised. So is that something that someone could possibly see you for after for some sort of scar revision?
Yes, and sometimes we even see patients who have had Mohs and then need some sort of reconstruction. Right. So that happens commonly, yeah.
Yeah, that's great. Well, thank you.
Very good. Thank you, Jordan.
That's a wrap on this episode of the Beautiful, Confident, and Safe podcast, brought to you by Lewisburg Plastic Surgery and Dr. Normington. Please be sure to subscribe to our show so that you never miss an episode. And for more information on Lewisburg Plastic Surgery, please visit us online at lewisburgplastic.com or find us on Facebook at Lewisburg Plastic Surgery and Dermatology or on Instagram at Lewisburg Plastic. We'll see you next time.